Hi, I'm Sinclair with the Power of the Patient Project. My guest today is Rafi Salazar, a licensed occupational therapist practicing in the state of Georgia. He is a graduate of Augusta University Department of Occupational Therapy and has worked on a variety of settings, from orthopedic and musculoskeletal rehabilitation to academia and even healthcare consulting. He spent the majority of his clinical experience working at Charlie Norwood VA Medical Center, where he was the lead clinician and a clinical education coordinator for an outpatient specialty rehab program. In this role, he treated many veterans with chronic pain and helped to establish an interdisciplinary pain management program. In that role, Rafi led a team to roll out a patient engagement initiative rooted in relationship-based care. After leaving the VA, he embarked on a journey as a clinical consultant and has worked on projects ranging from engagement initiatives to marketing communication campaigns to even a multi-million-dollar project assisting the state of Georgia's Department of Behavioral Health and Developmental Disabilities transition individuals out of state institutions to community residences. His main focus, and what we're talking to him about today, is his mission to improve the patient engagement and the patient experience. Welcome, Rafi.
Hey, it's great to be here.
So, can you just explain quickly the concept of patient engagement and how it affects the patient experience?
Sure. I think recently, probably in the last 5 or 6 years, patient engagement has become one of those buzzwords you hear. Everybody who's a digital marketer or marketing in the healthcare space person in general will say, oh, you got to up patient engagement and patient engagement is great. But there's very little definition around what constitutes patient engagement. The way I look at it and the way I tackle it and approach it with my clients and even in the clinic that I run is patient engagement is fundamentally what it is a patient being an active participant in his or her treatment process. So if you're running an orthopedic clinic, for example, it would be a patient who not only knows when their appointment is and is showing up to their appointment, but is following your recommendations in the interim, right? If you're an occupational physical therapist and you're giving patient a home exercise program, an engaged patient is a patient that is going to be completing the home exercise program in between visits, right? So it's all about making sure that patients are active participants in their treatment as opposed to passive recipients. And the way this affects patient experience is pretty simple. It's rooted in behavioral psychology and psychology in general, and that when we are bought in, or if we've put skin in the game, so to speak, we're more happy and we're more satisfied with the outcomes that we receive, both from a perceptual level and then from a clinical standpoint too. So there's research out there that patients who are active participants in their treatment, who follow and who participate in self-management programs, for example, end up having better long-term clinical outcomes, which again, if you have better long-term clinical outcomes, you're more happy with the experience that you had in the treatment facility and so on.
And now, why are you so passionate about improving the patient experience?
Well, I like to say that most people get into healthcare because they want to help people. And it was the same for me. So I got into occupational therapy and rehab because I landed on a bottle when I was fishing out of the river and cut up some tendons in my hand, and ended up being in an outpatient occupational therapy rehab clinic for the balance of the summer before my senior year. And I was there 2 or 3 times a week. I was in and out of splints, doing exercises, getting all kinds of treatment done. And one of the things that really struck me was my therapist. Not only did she give me the exercises, did she tell me what recommendations I had to do, but she was very involved in what was important to me and what were my goals for treatment. One of them being I was a high school senior, so I wanted to get back to playing guitar, and she had me bring the guitar into the clinic. She had me work on specific exercises for getting back to playing the guitar, and that experience stuck with me into college and into when I ultimately decided to pick a career, what I wanted to do when I grew up. I wanted to do that. And that was only possible because my therapist, when I was in a clinic as a patient, was not just somebody running through items on a checklist or running through some protocol that was out of a textbook or something like that. But she took the time to know me as a person, to understand what made me tick, so to speak, and then built my treatment plan around those things that were important to me. And when I started my career as a clinician, that's what I wanted to do. So it's something from the very beginning of my clinical experience in my education and in my experience in healthcare has always been very important to me. The idea that as clinicians, as healthcare providers, our mission and our primary calling is really to understand the individual needs and the individual factors, if you would, of each patient that walks into our clinic, and then to help them chart their own unique path to recovery.
Right. Wow. That's a really great story. Thank you for sharing that.
Oh, yeah.
And as an occupational therapist, I'm sure you have seen many people in challenging situations medically, but you've helped them with your interventions. So, how can patients benefit from approaching any kind of medical treatment with a more positive and hopeful outlook?
Yeah, I think there's a lot of research out there in the field of positive psychology these days. There's actually a great book, if you're a clinician listening, the book is called Called to Care. It's by a physical therapist named Dr. Larry Benz. And he does a pretty good job in that book of highlighting the research that connects positive clinical outcomes, which is just a fancy way of saying meeting your goals and getting a good outcome after being pain free or long term health, with the the notion of patient expectations and patient perceptions. And really, the long and short of it is, if patients expect to get better from treatment, even if it is the same exact treatment, just the simple fact, the same exact treatment delivered to two different patients, one patient expects that they're going to get better and one patient does not expect they're going to get better. The same exact treatment delivered to those two patients will yield different outcomes, in that the patient who expects to get better will get better. Now, I'm not saying that everything that your clinician is going to do to treat you is going to be that way, but for a large majority, and we're still understanding this, the science is still coming out around positive psychology and cognition and how our brain is really responsible for creating the reality that we experience. So something is hot to you, it is hot temperature wise, but you feel that it is hot because your brain tells you that it is hot. So it stands to reason that if you begin to believe that what you're going to do is going to have positive benefit for you in the long term, you're going to receive some sort of positive benefit from it. Mm-hmm. Even if those treatments might have marginal benefits clinically or might even be quote unquote placebo in effect, right? Like that's why placebo studies work so well, is because we're able to test an intervention against the normal positive bump that you would get, so to speak, from a placebo or an inert intervention.
Yeah, mind is very, very powerful place.
Yes, for sure.
And finally, with the practice of medicine having changed so much, especially within the last year, what are your thoughts on the new model of what patient care will look like in the future?
Yeah, I think there's a couple ways to handle this question. There's the whole like service delivery method, and I do a little bit of consulting in the space, and I've written operational guidelines on telehealth, for example, and all that. And all that is well and good, and we should definitely be innovating in how we deliver treatments to patients. But I think that's a different topic. I think this question really should highlight what is our fundamental approach, if you would, to addressing patient care. And now, for the last, basically since medicine was instituted thousands of years ago, the approach has been a very biomedical approach. And what I mean by that is that patients are seen really as the sum of their symptoms, and there's something called a pathophysiological dysfunction going on, right? There's something in the physiology that is wrong, and that is why this patient is experiencing pain, or that is why this patient is experiencing this limitation. And what we need to do as clinicians is fix whatever is going on physically or biologically, and they'll get better. And what we're starting to realize, and what we've begun to see over the last 20 or 30 years of clinical research in this area, is that people are not just muscles and tissues, right? we're built of three components, and requires what's called a biopsychosocial approach. So there is the biological, and that is absolutely real. If you cut yourself, you're going to feel pain. There's going to be inflammation. You're going to have bleeding. But there's also the psychosocial aspect of what's going on in every patient, and that varies from patient to patient. A good example of this is at the VA, for example, when I was there doing work with veterans in chronic pain, patients that might have had maybe an injury that was not tied to a traumatic experience might react entirely different to a certain intervention than another patient who had the exact same injury, but his or her injury came from maybe a combat related injury or some kind of trauma. And the reason they had different outcomes was because psychologically or psychosocially, there were different factors at play. So as medicine begins to change, as we begin to plot the path to the future, if you would, of what we want healthcare to look like, we really need to shake loose of this idea of patients being the sum of their biological components or their biological pathways, and really start embracing this idea that people are multifactorial, which really just means there's the biology is at play, but we also need to address the psychological and the social and environmental factors that are affecting each one of our patients. And that is going to be different from patient A to patient B to patient C, even if they all have the exact same diagnosis, the exact same mechanism of injury. We need to look at them differently because they are unique individuals. I like to say, so I run a physical therapy clinic. Proactive Rehab and Wellness is our company name. And we like to say that every patient is on a unique road to recovery. And it's our job as clinicians not to fit them into our mold of what the textbooks say. It's not like a formula, plug X and Y and you get Z. But our job is really to tailor our treatment and our intervention to meet each patient where they're at on their own unique road to recovery instead of trying to fit them in our mold. So as healthcare progresses, that's definitely what we need to be doing. We need to be looking at patients as individuals and not as just diagnoses out of a textbook or a sum of tissues or symptoms.
Yes, definitely agree.
Yeah.
Well, those are all the questions that I have for you today. But
awesome.
Thank you so much for joining me and providing this really useful and insightful information.
Yeah, thanks for having me. Have a great one.